Karibu sana.
Asante.
Mheshimiwa Kipruto, how are you?
Morning, George. How are you?
I'm good, thank you.
Thank you.
And a lot is happening, especially on this conversation about SHA. I do not know whether you were able to interact with something we saw trending on the socials yesterday.
Yes.
Regarding the Social Health Authority. We are seeing that SHIF, according to the Daily Nation, page 4, has created two classes of Kenyans, and civil servants seem to be enjoying unlimited cover as other Kenyans struggle with the transition from the National Health Insurance Fund to the Social Health Insurance Fund. Mheshimiwa Kipruto, what do you make about this whole SHA and SHIF? Is it that we don't want to get it right, or whereas the executive has laid out the plan, is it once again another case of frustration and sabotage from what has been described sometimes as not very Afia House, but Mafia House?
Yes. Well, George, it's very interesting because I had the president on Jamhuri Day expressing his frustrations that Kenyans have not given him a fair chance to be able to roll out his programs, including the issue of health insurance. But when you look at it very keenly, there are a number of things that riddle the organization and many other programs that this government has put in place. Principal among them is this issue of health insurance. We've been pinpointing a number of challenges patients are going through in order to access services. We've been pinpointing that, yes, if there was any governance issue with NHIF, does it change by you changing the name? And the answer is no. So what could be the motivation for us to change from one name to the other unless there is some kind of lucrative business somebody is likely to draw? And it's coming out clearly that part of the failure of this regime is that when you have two minds, one mind is to give what is good for the public, and the other mind is to create some kind of business inbuilt in whatever you want to make us look, feel that you are doing something for the good of the nation. So it is a clear evidence what the Daily Nation is telling us today is that it's a very clear demonstration that by saying those who cannot access services because they cannot afford, they will be treated nonetheless. Yes, they will be treated, but what is the level of treatment? Are they going to be treated at the same level as those who are able to afford the kind of cover they have already paid for? So the answer really, if this regime is interested in the public good of Kenyans, what they should do is to create a system that is friendly to all. After all, majority of Kenyans who pay some of these insurances, they don't end up in hospital. So if there was proper governance, a lot of money would still even remain even after giving everybody a fair treatment whenever it is a health facility or a hospital for that matter.
Kisia, what do you make of this SHA? I know we've talked about